From CBS 4, this is Aging Independently with Christine Bartel, empowering seniors to live on their own terms in their own homes. Sponsored by Amedisys Home Healthcare, caring for your loved ones as we would our own.
Hi everybody and welcome to our show. It happens all too often. A patient is discharged from the hospital, goes home, and for one reason or another quickly ends up right back at the emergency room. But there's good news. A recent Medicare study found that over half of all ER admissions are preventable, and many return visits can be avoided just by following a few simple rules.
After being in the hospital, being treated, and discharge is to turn around and come back.
Dr. Lauren Frazier specializes in managing care for adults who are hospitalized. She says avoiding a return trip starts before you even arrive.
When they come to the hospital, come with a correct list of all the medications so that from the beginning we start with the correct list.
When it's time to leave, Dr. Frazier says the patient and their loved ones need to tune in. We're asking patients and families to also work on this and be accountable.
And so medicine being so complex, it's really important that we providers do our best to explain things to patients and their families, but it's also very important for patients and their families to not be afraid to ask questions.
So when you leave, closely following your doctor's discharge care instructions and taking the right medications can keep you from going back.
Adhering to that plan is critically important.
Kate Jones is the Chief Clinical Officer with Amedisys Home Healthcare. Thank you for being here, Kate.
Thank you. I appreciate it.
This is the biggest topic right now on the Hill. Everybody's talking about it. Physicians, providers. What are we talking about?
What we're talking about is care transitions. That's the term for when somebody moves from one level of care to another. So the most typical one is hospital to home. And we're talking about what you can do as the patient to advocate for yourself and for you to have a smooth care transition.
It's very important for seniors and family members, anybody, to understand that when they get discharged from the hospital, they need to comply. They need to be organized. Let's talk about that.
Sure. There are a few things you can do, and one is to start thinking about it well before you get discharged from the hospital. So ask questions in the hospital. What will I need when I go home? Do you anticipate that I will need some type of assistance in the home or some kind of skilled care in the home, such as home health care services? Once you ask those questions, you can start preparing. The biggest thing that you should pay attention to on discharge from the hospital is your medication list. Make sure you have what you know to be an accurate medication list, and make sure your doctor knows about any medications that you were taking at home, and ask the question, should I be taking what I took before or this new list? Who's going to help me figure that out, and make sure there's a plan for that, because medication errors following hospital discharge is one of the #1 reasons for readmission to the hospital.
It's so confusing. And if you're on a number of medications, how would you ever know? You must make sure that you know what you should be taking once you're discharged, because it could be completely different than what you were on when you came to the hospital.
Absolutely. So somebody often needs to help with this, right? So you may have a family member who's able to help bridge that gap for you. If you were in the hospital, you're probably not feeling great. So when you go home, even if you were completely able to manage your medication regimen on your own, this may be a time when you need assistance. Ask your doctor, am I going to have somebody help coordinate my care from hospital to home? Am I going to have a referral for assistance when I get there?
Right. And ask for home health care companies and care transition coordinators.
Exactly.
Thank you so much for being here, Kate.
You're welcome.
For more information on your home health care options, call the Amedisys information line at 1-877-877-8145. You can always go to our website for more information to take today's poll question and learn more about aging independently by watching all of our shows. Just head to cbsdenver.com and click on Aging Independently. Be sure to join us next time for more information on staying independent in your home.
Thank you for watching Aging Independently with Christine Bartel. Sponsored by Amedisys Home Healthcare, caring for your loved ones as we would our own.